Heartland cares about your wellness, and cancer prevention is possible through preventive screenings. I had a chance to sit down with a colon cancer expert, and I wanted to share this important information with you.
Colon cancer usually starts with polyps, which are like little wart-like lesions that can grow in the colon, and then some of them have a potential of growing and growing and growing over many years and then can turn into cancer. Current recommendations say to start at age 50. There are several risk factors for colon cancer. The things that we can control is obesity. There have been many studies that show that being overweight increases your risk of colon cancer. Smoking, heavy alcohol use are another ones. And with regards to diet, a diet high in red meats or processed meats have shown an increased risk of colon cancer. The biggest risk factor for getting colon cancer is if you just don't get screened, because then you just never know. The stool cards and other screening options are really meant to get as many of the people at least screened to see if they have any risk factors, and then sent to us to actually perform the therapeutic measures. Both of those stool cards are done every year if you choose to go that route, assuming that they're normal. If they turn up positive, then you'd be referred to a gastroenterologist for a colonoscopy. Endoscopy is where there's a camera on the end of a long tube that we insert into the colon, looking at the colon wall for these little lesions, those little polyps. And if I do see any, we can remove them. And we have other things we can do, such as just checking for the overall health of the colon. Do you have hemorrhoids? Things like diverticulosis, any inflammation, and basically do a full assessment of the colon. Those procedures is pretty much the gold standard when it comes to colon cancer screening, because at that time I can not only look for any type of lesions or polyps, but also do therapeutic options and actually remove them. The biggest thing that people fear about a colonoscopy is usually one of two things. One, the night before you have to do the cleaning out process, the bowel prep. Nowadays we do things like split prep, meaning you do half the night before, half the morning of the procedure. So that makes it a lot easier on their patients with regards to the amount of medicine that they're drinking to help clean out your system. And the second thing that kind of was a fear in a lot of people is the sedation, meaning am I going to be awake or do I get medicine at all? The colonoscopies are definitely done with sedation, though they can be done without if need be. The sedation nowadays, most people can go through the whole procedure without any discomfort. Usually the procedure takes anywhere between 15 to 20, 30 minutes. It all depends on how clean it is, if we see any polyps. In the best case scenario, stage 1 cancer is just confined to the colon, and you can remove it surgically, and then that is it. That's our goal, that if we are going to find cancer, we want it to be early.
At Heartland, preventive screenings completed within the recommended guidelines are covered at 100%. I encourage you to take advantage of this Heartland benefit because your health matters.